name is Isabel. I'm here just to give some support to Dr. Janis Kupersmidt from the Innovation Research and Training, and to Mar Avendaño from consultant and also part of the Coordinadora de Mentoría Social, who is organizing this mentoring summit. Mar and Janis are both going to present two quality improvement systems for mentoring programs, one in the United States, the Elements Quality Improvement Process, EQIP, and one in Spain, the Sello de Mentoría de Calidad. Okay. After this short presentation, we are also going to make you work a little bit. We have different examples of problems encountered by mentoring programs, and you all will develop a deeper understanding of the value of reviewing their program practices. Okay, so we hope that this exercise is very useful in that sense. So I think you're all waiting to start. So Janis, whenever you want, if you want to start the presentation.
I think it'd be nice to just also start by knowing a little bit about you all. Maybe you could put in the chat box whether you've had, or is there a way to raise your hand or something? No, I guess there's a reactions. What is that? Maybe a thumbs up. Have you ever had any experience having your program evaluated or being involved in some way in the evaluation of the quality of a mentoring program? I'm kind of curious about how new this is for you. Oh, okay, so several of you have a thumbs up. Great. So we call it preaching to the converted. So it sounds like a lot of you already know the value of this and have done this kind of work before. Let's see, is this the first slide? Oh, great, in Australia. So it sounds like some of you do a lot of evaluation. That's really exciting. And we look forward to learning from all of you, and hopefully we'll present a couple of slides and then really get a conversation going amongst all of us. And at any point, please feel free to, I guess, I don't know what you do, raise your hand or jump in, and maybe Isabel could monitor the chat box if you have any questions, then we can unmute you, or you can unmute yourself. So we'll just get started. We just wanted to do a few minutes of an introduction and get to know each of you. And Mara and I can introduce ourselves. I'm a child clinical psychologist. About 15 years ago, I started doing research in mentoring, but before that, I'd had a very long career, almost 30-year career, studying children's relationships with their peers, and also examining risk factors, risk and protective factors for delinquency and substance abuse. For a long time, I was a professor at a university doing training in basic research. I, at some point, decided I wanted to do full-time research and gave up tenure and moved to work with a small behavioral sciences research organization that I founded called Innovation Research and Training. And it's in that context that I've been really doing a lot of doing the work that I do on mentoring programs. And the work has been diverse. It's been policy oriented and research and sort of program development work. Anyway, Mara, do you want to just take a few minutes and introduce yourselves? Because I think it'd be nice for everybody to know a little bit about you.
Yes, sure. Hi, everyone. I'm Mara Avendaño. I am graduating in sociology, and I have been engaged professionally for more than 10 years in the fields of social action and development cooperation, also in social research. And I have been in design and systematization of different methodologies of interventions, and specifically in social mentoring programs, passionate about analyzing social issues, building theories of change, and try to design interventions to transform a little bit the society. Then a pleasure to be here with every one of you.
Today, we really wanted to figure out a way that we could all interact. And so we actually spent quite a bit of time. We worked on this workshop even back in January when we thought we'd be in person in March in Barcelona. And then we've continued to work since August on it. And we thought we might just start out for people who are not familiar with quality evaluation kind of comparing different forms of evaluation so we can put this within a context. So probably the kind of evaluation you're most familiar with is the one in the middle, the outcome evaluation, where you ask the question, is the program producing the intended outcomes for its participants or clients, or in this case, mentees. Usually mentoring programs are organized around achieving certain outcomes for mentees. And so a way in which you might assess that is measuring whether mentees in the program have, typo there, have received the grades and received better grades in school than children who did not have a mentor. And then a process evaluation is really looking at the extent to which a program is implementing the practices that they say they're doing. So if a program says, we train every mentor, you might go in and look at, in a measurement perspective, pull out files or records or look at electronic records to see if every mentor was in fact trained. Or if you say that every mentor was screened, you would go into the records and look for the results of the screening. And that's kind of what we call an audit. One might do an audit along with a quality evaluation. So in contrast to that, quality evaluations are relatively newer to the mentoring field. And in the case of a quality evaluation, one would really look at the extent to which one would evaluate a program's stated policies, procedures, and practices. So in that case, you would look at one's standard operating procedures for a program, their policy guides. You would look at their applications, you would look at the training manuals they use, and you would examine the extent to which they align with the standards for the field. So you could have program staff complete a questionnaire, you could interview them, you could review the guides used in the program and the materials to see whether or not, for example, if they have a policy of contacting each mentor and mentee once a month to make sure the match is going well. If that's one of the standards of the field, you would see if that's part of their policies. So does everybody understand the difference between these three kinds of evaluation? Okay, great. Well, let's move on then. So why we thought we would sort of first ask a few questions of like, what are we talking about with the quality systems evaluation? What does that mean? And so I think as a clinician, I would say, and as a person who's dedicated to, you know, kind of creating programs for kids, the medical practice, you know, has kind of an adage of first do no harm. And so the first thing is you want to establish practices in your organization that are designed to keep people safe. And I think originally we thought, well, we want to keep mentees safe, but we want to keep everybody safe, mentors and program staff. So you want to have policies and procedures and practices where you first do no harm. You know, I mean, the whole point of the program, of course, is to enhance people's lives. So you want to do everything in your power to keep everybody safe and healthy. Second, you want to do better. You want to not just sort of create a program that maintains the status quo. You know, we know mentoring programs generally have positive impacts, but we know the impact overall from the meta-analyses, we know that the impact is generally small. One of the things that we hope is that by changing your program practices, you can have a bigger positive impact. And there's some data, growing data, to suggest that, you know, as you implement practices that are aligned or reflect the research findings in the field, you can have a bigger positive impact. And then I think the third thing is that when you standardize your practices, when you use safety-based and evidence-based practices, you can reduce disparities in the experiences that both mentors and mentees have in your program. And you can potentially reduce the disparities among mentees so that everyone has a more equitable experience. And so you want to behave equitably. And those are sort of three big reasons why we believe in, you know, a quality evaluation and implementing a quality improvement system. Okay. So how do we do that? I think there are, when you look across the medical, like the health sciences and the education fields, I think that they bring some wisdom to how we think about doing a quality evaluation. So one, you have to have a set of standards of practice for the field. We have done that in the United States. I was fortunate enough to be part of the team that did that. So in the late 2000s, around 2007, 2008, we did a comprehensive review of the literature of mentoring and started to create a set of benchmark practices for the field of mentoring that were based both upon safety recommendations from mentoring programs and based upon the latest findings in the science that would inform what a program should do, and that's called the Elements of Effective Practice for Mentoring. It's a somewhat unique document, and I'll put in the chat box a link to it. We've also now more recently, over the last 2 years, written 7 or 8 supplements to it for specialized mentoring programs, and I'm excited to hear that I think that there will be funding from the National Mentoring Partnership for us to write some more. And I think at some point we'll go back. We've done a 3rd edition and a 4th edition. Both of them are evidence-based. And I've actually done research on the 3rd edition, and I'm doing some research now on the 4th edition that should come out in the next year. And I hope we'll be able to do a 5th edition. And because the research is continuing to come out, and I think we can update the recommended practices. And so to me, having standards for the field, I could do a whole presentation on that. And the EPM, of course, I could spend a day on that. It's a really rich and interesting endeavor. But you also have to train the staff of your program, a mentoring program, on motivate them about why to engage in an evaluation and how to do it. I think the other thing is you need a psychometrically strong assessment tool to assess, or tools to assess what a mentoring program is doing, and be able to measure it in an objective way. And so we have created an assessment tool that's online. We've also created follow-up interviews to probe more deeply into practices. It's not a small procedure to do it. It can take a program, 8 hours to gather all their documents, to review all their practices, to think deeply about what they're doing, and then to complete, a kind of comprehensive questionnaire. So it takes a lot of dedication and purpose to really engage in this process. And then you need to be able to provide the program with feedback to say, okay, well, here's what you say you're doing, or here's what your files suggest, here's what we think you're doing. One interesting anecdote is that we have found programs to say the first time they fill out a questionnaire that they're doing everything, and then they go back, and then the second time they do it a year later, they say that they're not doing all the things they thought they were doing a year ago. And I think part of it is that they become self-educated, either through the process or through really learning about practices where they realize that they thought they knew more than they knew. And so it looks like they've gotten worse, but I think they've just gotten more educated. And then you also can work with a program, or they can do it themselves, or they can work with a technical assistance provider to develop a quality improvement plan that we believe, and a key part of it is including prioritizing what to change, when to change it, a set of tasks about how to do it, a timeline for doing it, and then a method for evaluating when they've been successful, when they are done, when they've achieved a certain accomplishment. And then implement the plan. And then, of course, we see it as a cyclical process. That's how it's viewed, I think, academically, or, from the field, that this is an ongoing process that you always have to revisit. Yeah, and I will, when we get a break, I'm going to put up a link to everything so that you'll have it in the chat box. Okay, next slide. I'll tell you briefly about EQUIP. So after I co-wrote the Elements of Effective Practice for Mentoring, I became interested in, and actually a funder asked me to evaluate if the mentoring programs they were funding were following the elements. And I was like, well, how would I know that? So I looked around, and there were a couple of states in the United States that had begun doing some quality improvement work for programs in theirs was evaluating at the time. We're not in those 2 states. And so I applied for a grant from the National Institutes of Health, NIH, which is our largest funder of health-based research in the United States, and got this really nice grant to think deeply and read about and study quality improvement in mentoring programs. I want to say, because there's a little bit of controversy about this process in the United States right now, this process is meant for formal youth mentoring programs. It is not meant to provide a standards of practice for informal mentoring. And what I mean by informal mentoring are when like a neighbor or a teacher is informally mentoring a child that they know. There's millions of people that informally mentor youth, but they're not part of a program where they've signed up and the program is either making the match or monitoring the match. These practices are not, they're also not designed to kind of govern the actions of a mentor. They're designed to govern the actions of a program. So, or not govern, but make recommendations for how a program would operate. And in this case, the EQUIP and the EPM, the elements of effective practice, are to give information to the staff about what they would do and how the program would operate, not what the mentor does. Of course, the staff, this would inform the policies of the program, and then the program would set the actions of what they would be asking mentors, mentees, and parents to do. So just so kind of you understand the politics of this. It's based upon research on mentoring and quality improvement. Our system comprehends the benchmark practices in the elements. And as I mentioned, includes a self-paced online training for mentors, for mentoring program staff, as well as the web-based program self-assessment tool. And then, of course, the process can include technical assistance, and someone could take the report that comes out of it and get technical assistance from others, not just from our organization, but any organization I think that is familiar with the field could help work with a program to improve their practices. And then the next slide. I'll just quickly mention that programs were asking us, how do we know that we're at the highest level of quality or we're doing everything? And so we created this 4-tiered certification system. One is just that a program does the online training and the program staff complete the self-assessment, so they get the self-assessment seal. Then if they go through kind of the external objective review that we do, which is pretty labor intensive, then they get the bronze seal. If they are implementing, if we determine that they're implementing all of the safety practices, then they get the silver seal. And if they're doing everything, safety practices and evidence-based practices, then they get the gold seal. And so we've had a few programs go through these different levels of certification. I'll stop now and I could take questions later. And Bar, I'll talk about the Spanish system.
Thank you, Janis, for your presentation and for your amazing job. Okay, now I'm going to present the quality, the MC quality certification and evaluation system developed by the Coordinadora de Mentoría Social to assess mentoring social programs that aim at supporting socially vulnerable people. I would like to thank all the people who have proved their expertise. Without them, the MC certification will be not a reality today. Of course, the teams that participated in the testing actions and in the focus group. The MC certification, it's an evaluation system based on the experience on 2 international systems, the elements of effective practice for mentoring team from the US and the approved provider standards from the UK. It's a system contextualized on the Spanish reality and its tradition of voluntary work. The evaluation matrix establish 10 requirements to validate the methodological quality of each phase of the mentoring project. And for each one, a set of standards is required. There are 2 levels of the certification to promote the progressive and sustainable improvement process of the project. One is the MC that requires all the basic quality standards to be complied with. And the MC Plus requires the fulfillment of a minimum number of additional standards. Thank you, Isa. The process started with an online self-assessment and a first improvement plan. After the implementation of this plan, we started an audit process that leads to a new improvement plan. To validate the compliance with the standards, we carry out documentation reviews and interviews of the technical teams, mentees, and mentors. We understand that the auditing process is a way to nurture quality mentoring rather than just validating the compliance of the standards. The key is nearly always in working closely with the technical team. And I don't know if you have some questions, you can find more information in the Coordinadora's website. I will pass the link in the chat, and you can test your project in the quality test room that you can find in the Summit's website. I will also share the link in the chat. And thank you for your attention. I give the word to Janis, who will explain a little bit the workshop activity.
Hi, that's great. So we thought what would be fun is for you to have the experience of doing something that we do, which is sort of go into a program, learn a little bit about their practices, and sort of think about what kinds of things could have prevented sort of a problem from occurring, and what kinds of policies and procedures the program could have developed to prevent an issue from happening. And so, we created 5 different scenarios, and would like you to get a chance to sort of talk about them and think about them from a practice point of view, in terms of like how the program could have been proactive. So when we go into the breakout rooms, if you could pick a person who might be a presenter for your team to talk about the results of your discussion, and maybe Mara, I can't remember, does everybody take notes on the document, or is one person a note taker? Or Isabel, do you know?
I think, Janis, that maybe Isabel can explain a little bit how we can work for the dynamic.
I don't know how to do that.
I see in the chat there is one question asking from if they're applied to those mentoring adults. In the case of the MC quality certification, we have different standards from a project with the participation of minors age, that it's different, quite different. There is a lot of standards that are the same, but there are differences. And I think also, Janis, there is some question for you.
Yeah, and I've been answering some of the questions in the chat, and I'll try to get to them all. So yeah, I'm not sure if you pronounce your name Lucia or Lucia, actually, sorry. So I was just saying that you can do a quality improvement evaluation with programs that range in size from having 1 paid staff member to, 20. I think it doesn't matter, because it really has to do with sort of thinking about how you set up your program. Like what, and maybe we're being a little too vague and I need to give you more examples, I'm not sure. But everything from, do you expect your mentors to make an application, or your mentees? Do you train mentors and mentees? What is the policy you use for matching them? Once they're matched in their meeting, how frequently do you talk with them? When you talk to them, what do you talk about? When there's the first meeting between the mentor and mentee, what happens in that meeting? So really what you're doing is you're kind of unpeeling or opening what we call the black box of what's happening in the program. What do you require in the program? And that's really what's involved in a quality evaluation, is your policies, your practices. So, and then I can't tell you how many have been involved in EQUIP until now, because people are at so many different levels. I'd have to go back and look at it. I mean, we have, maybe from one organization in the US, there were 25 programs that went through just one part of EQUIP, and they did it every year for 3 years. And we're actually studying them also and looking at how their EQUIP scores change over time and how those scores and changes over time are related to youth outcomes and match length. We're involved in a research project on that right now. I think those are all the questions. So, but feel free to ask more, and I can also be available at the end of the workshop to answer questions.
Perfect. Thank you, Janis, for answering all these questions. I'm going to explain briefly the exercise as Janis was doing before, just to recap a little bit. For the next 20-25 minutes, we are going to divide all of you in different rooms, okay? You will see that each room is numbered, so you have one number 1 to 5. And we also have 5 scenarios, so each group is going to read their scenario, and you're going to, oh, I cannot pass the slides. You will see a scenario like this one that you can see on the shared slide. And then we ask you to debate about it. Do you think that maybe some things should have done differently in this project? Maybe there's some improvements to be done in that program. You need to discuss that among the group. We ask you to write, please, the main points of your discussion in these slides. And then the next one is to maybe think what things should be improved and to decide the order of prioritization of these improvements that needs to be done, okay? So I'm going to share on the chat box the link for the Drive presentation where you will find all the different scenarios. And then we're going to divide you on the small rooms. We're going to send you some message to know how much time there's left. And if you have any question, there's a button on the bottom of the screen where you say you can ask for help, and we will come around if there's any question. Okay, I don't see your faces because I'm sharing the screen. I don't know if everything's clear. Good. Okay, then we start with the rooms.
Yeah, we had a few final ideas about remembering that this is for formal programs. We also know that practices need to be contextualized to reflect the goals of the program and the environment and the culture where the program's located, the country, as well as the culture. So some of the practices may vary based on where you are, what your laws are, that kind of thing. We also know that programs are often under-resourced and they have to really think about what to do to change their service delivery system. And I think that several of you really highlighted that, how stressful that is for programs to change what they do. I think like one of the things we heard is a program staff person might say, well, that means that I have to do something different or I have to add to my workload, and that can be really difficult. And I think it could also be a very rewarding practice to engage because you know that you're creating a program, a more impactful program, and a more equitable program for everyone involved. And so hopefully that's motivating. It was really a pleasure to meet you all. It's so exciting that we're from all around the world and we are getting to kind of hear what we all think and what we do, and we have a really kind of similar mission. I would just say, you know, feel free. I don't have all of your emails, but some of you have reached out to me on LinkedIn. Feel free to email if you're involved in developing quality improvement systems. We could continue this dialogue with one another. Like I said, I'm also a researcher and I'm researching this process. And if any of you are interested in doing research, you know, reach out to me. It'd be really fun to, you know, collaborate, especially if you're doing this, you know, different countries with different systems.
Thank you, all of you, for your work here.
Yeah.
It will be a pleasure to have you in our evaluators teams. You have a good eye. And good luck with your projects.
Yes.
And you all success also. Thank you.